Hi, I'm Dr. Didier Demesmin from University Pain Medicine Center. I'm the medical director of the University Pain Medicine Center. Also, I'm director of the Pain Fellowship at the JFK Medical Center in Edison, New Jersey. I'm also an advisory board of Bella NYC magazine, and I'm also the director of pain at St. Peter's University Hospital in Central Jersey. So today I'm here with Mrs. Cabri, who presents with neck pain with upper extremity radiculopathy, meaning that the pain really down to the lower extremity, to the upper extremity. And she also presents with back pain with leg pain as well, where we call it radiculopathy as well. Mrs. Cabri has a very active life. She's a fitness instructor, and she does a lot of running and a lot of sports activities. So sometimes that gives a patient, that puts a patient at risk to develop back and neck pain. So essentially, when a patients present with neck pain, some of the reasons why they can have the neck pain can be due to a disc herniation, or it could be due to what we call facet syndrome, which is the joints of the neck. It can also be due to what we call the musculoskeletal system, which is like muscle spasm, etc. So what we do at the office when a patient presents with back and neck pain, it's very important that we conduct a history to see exactly the situation that may have caused the pain to occur, and to evaluate the films, like looking at the MRIs, the X-rays that we have available, so we can see exactly what's going on, so we can formulate our treatment options. In addition to that, a physical examination is always performed where we test for strength of the lower extremity, of the upper extremity, to make sure there's no motor abnormality, meaning there's no weakness going on. And we also test for sensation, which is part of the neurological examination as well. Because it's important to know that if there's any weakness or neurological symptoms, sometimes a patient may require surgical intervention as opposed to going to a pain physician like myself. So Mrs. Cabri presents with cervicalgia with upper extremity radiculopathy, meaning she's having neck pain and pain shooting down to the arm. In addition to that, she presents also with headaches as well. So there's a lot of different reasons patients can develop neck pain. It could be due to a disc herniation, can be due to disc degeneration, can be due to facet problem, what we call the joints of the cervical spine, or it could be the musculoskeletal system that's causing the patient to have pain. So what we do, a physical examination is always very important. So by doing the physical exam, we do palpations where we look for any kind of abnormality in the muscle, if there's any spasms, and we also look at the range of motion of the patient by asking the patient, for example, to tilt their head to the side versus the other side, to see if there's any restriction of motion and if we can elicit the patient's pain. Other physical examination that we do involve the reflex exam, where we check for the patient's reflex. We check what we call the bicep reflex here. We check the brachioradialis reflex by going here. And we check also the tricep reflex by going posteriorly. In addition to doing that, we do a basic strength examination where we ask the patient to do things like, if you don't mind just keeping your hands up and push against my hands, you push and you pull towards you. Okay, very good. So all these things, we test different strength to make sure there's no weakness going on, which may be an indication of something more alarming going on. So the treatment options that we offer are various, but we pride ourselves in offering what we call minimally invasive procedures to treat patients with neck pain going down to the lower extremity, to treat headaches, a lot of different pain conditions. In addition to treating neck pain, we also treat back pain. The back pain as well can be secondary to a disc herniation, facet syndrome, ligament problems, can be the muscle, the sacroiliac joint. There's a lot of different reasons why a patient will develop back pain and leg pain as well. So my job as a physician is to conduct a very thorough history to try to see exactly where the pain may be coming from, and combining it with imaging studies like MRIs, X-rays, CAT scans, and performing the physical examination. After doing all three, then we formulate what our diagnosis is and the different options that we have to treat it. So, should you have any additional questions about what we do at University Pain Medicine Center, feel free to look at our website, and also you can call the office, which will be provided. Our office are located throughout central New Jersey, and we also have locations in New York and also in Florida as well. Thank you.